There's an incredible movement of health-conscious entrepreneurs, managers, and businesses in the United States realizing how critically important screening for critical diseases and the ensuring of the health of their employees and teams are. Not only in respect to workers living a happy and high-quality life with regards to the individual, but also as it relates to creating healthy families and productive and thriving workplaces. And now, employers are realizing, especially now, that in the 21st century, having mentally and physically healthy employees and teams lead to much less reduced leaves or absences, much less project and work interruptions, much happier employees, much greater productivity, much lower long-term business costs across the board, reduced sick leaves, reduced risk of losing quality talent, and less people resigning or getting laid off due to psycho-emotional and physical health reasons. 1 in 2 Americans will get heart disease. Almost 1 in 2 Americans separately will get cancer. If someone on the team gets cancer, that person won't be able to work for minimally 6 months to a year. He or she is going to have to pay tens of thousands of dollars or more out of pocket. Not to mention the stress on the team at work, on the family as well as friends for that individual is tremendous. These 2 diseases make up the top 2 causes of death in the US. Not even COVID at its peak surpassed the impact of these 2 diseases. Then there's the rising rates of diabetes, autoimmune diseases, and many more dangers that are detrimental to a person's health. There's a big fallacy that health insurance will prevent these creeping dangers. 95% of the time, insurance isn't doing anything beyond a minimal standard of health guidelines to prevent, catch, or ensure the optimal health of an individual. Usually until things are already bad and symptoms appear. The responsibility to ensure one's optimal health is really on the individual as well as one's family, community, and place of work. However, the truth is, we can really prevent or catch all of these diseases extremely early because we have reached an intersection of where health tech and medical knowledge have really come together within the last 5 to 10 years to achieve a phenomenal result. We can now analyze one's genome even to understand the 5 to 15% of cancers that are genetically based. We can find cancer at just a few hundred to about 500,000 cancer cells instead of the typical billion cancer cells. We can locate plaque in the arteries in early stages before it becomes heart disease. We can understand the age and overall health of one's brain, as well as the composition of the microbiome, the body's first defense at fighting off diseases. Businesses are realizing that if they invest in the health of their employees and teammates, then everyone wins. It's really a win-win for everyone involved. The real question is, how does one approach this problem today? How does one fix it? We've spent 20 years getting to a point where we can solve this riddle both with the right knowledge and technology. Preventive medicine and cancer care is now at a place where we are 14 times more effective at catching or preventing these diseases than traditional medicine. And we want to empower the Denver workforce with the right knowledge, mental tools, the physical tools, and the screening technologies to make a tantamount shift in our community's health. We've developed the longevity program to be education-rich, information-rich, cost-effective, and value-rich along the right screening modalities to effectively give teams in Denver the ability to catch and reverse internal dangers like cancer, heart disease, critical diseases, brain health issues, chronic fatigue, and headaches, as well as a number of other lurking health challenges. We invite you to contact us to schedule a private workshop guided by Dr. Mark Lewandowski, MD, to enable your team or organization with what they need to know and take advantage of the necessary knowledge and tools available to prevent and screen for the dangers to one's health.